3 Ds of advanced care planning: how to decide, discuss, and document your end-of-life wishes. My name is Garrick Colwell, and I'm an advanced care planning educator and co-founder of Kitchen Table Conversations. Kitchen Table Conversations is a nonprofit organization that was created by my late wife, Kinsloe, and myself, along with 20 other healthcare professionals, for the purpose of educating people on how to complete their advanced care directives. In this video, we'll be talking about discuss, which is the second of the 3 Ds of advanced care planning. In this video, we'll learn how to discuss your end-of-life wishes with your loved ones and with your healthcare professionals. But before we get started, let's just take a moment and visualize or see ourselves at a kitchen table, sitting in a comfortable chair. We have our favorite beverage handy. We've got paper and pen close by for taking notes or recording questions we may have. And then please take a moment, pause this video, and also take time to download the companion document for this video, which is located on the same page you found the link for this video. Just take a moment, pause, make sure you download the document so you can follow along as we continue. Welcome back. Still at the kitchen table, just take a moment to center yourself, bring your attention to this moment. I want to remember to breathe deeply. Just kind of relax into our time here together. Be sure that you have the freedom to pause this video at any time. There's a lot of information that you're going to be receiving. If you feel overwhelmed at any point in time, just take your time, pause, come back to it at another time. Above all, in general, make sure you take your time with this. Assimilate it in the bite-sized form that's best for you. So just be good to yourself. This is a lot of good information, but it's a lot of information at the same time. Let's review for a moment what the benefits of advanced care planning are. Well, they prevent painful, unwanted, and potentially ineffective interventions. That would be medical treatments that may be possible but not necessarily effective, or that those medical treatments themselves, perhaps another round of chemo, might put you in a position where you're sick all the time and you don't necessarily want to be sick towards the end of your life in a way that you can't interact and be present with your family and your friends. Another benefit of advanced care planning is it improves the quality of your care. And it also decreases the decisional conflicts within the family and your healthcare professionals. So basically, you unburden your family with making end-of-life decisions on your behalf by making sure that they know what it is that you want, and you've appointed someone to speak for you when you can't speak for yourself. And in some unforeseen situation where they may have to make a decision for you, they'll at least be informed as to what your values, your goals, your objectives are, so they would be making the decision based upon what you want, not what they think you want. Another benefit is it increases the likelihood that your preferences and end-of-life decisions will be honored. If you don't write down your decisions and don't put them in your advanced directives, then in fact your medical professionals aren't going to know what to do as it relates to what your decisions are, because you haven't made any. So they're going to make the decisions the best they can as to what they think is the right thing to do, not necessarily what you think is the right thing to do, because they don't know what it is that you want. And the final benefit I want to talk about here is it brings you closer to the people you love. It gets you a chance to get to know one another in a more intimate level when you're sharing what your end-of-life wishes are. Because end-of-life wishes also help you frame and live more authentically in this moment. And so even though we're talking about end-of-life, we're also talking about living life well, living life vibrantly, living life aligned with what it is that you value most up until the time you die. So what holds us back in having these conversations? I mean, if you've looked at the other videos before this, you have come to a point where you might have a good idea as to what your advanced care plan might look like, what your wishes are, what your preferences are, and therefore ready to have this conversation. But at the same time, the people you're going to have the conversation with may not be as up to speed on all this end-of-life conversation stuff that as you are. And so I just want to remind you of some of the statistics that go along with why people kind of hold themselves back from having the conversation. Now, 21% of us have not had the conversation because they don't want to upset their loved ones. However, 53% of us would be revealed if a loved one started the conversation. And overall, 95% of us are willing or want to talk about our end-of-life wishes. So I give you these statistics and remind you of this once again because you're about to begin a process by which you're going to have conversations with your loved ones and your healthcare professionals. But at the same time, they may not be ready for whatever reason, but this may give you some perspective on the fact that, 95% of us at least are willing or want to talk about it. And 53% would be relieved if a loved one started the conversation. So let's talk about how those conversations begin. So I want to point your attention to this document that you downloaded previously. It's called your Conversation Starter Kit when it comes to end-of-life care, talking matters, produced by the Conversation Project. And I want you to turn, if you would, to page 7. And it's called Step 3, Go. Basically, here's where you're going to outline and choose who you want to talk to, when would be a good time to talk, where you'd feel comfortable having this conversation, and to make sure that you have written down what it is that you want to be sure to say. This is important for you to be prepared and to have a pretty good picture as to who, when, where, and what it is that you want to do. Now, if you would turn to page 9 and remember the following. Be patient. The person you're talking to, you may need to adjust what you're saying based upon their response. They may say, I don't want to talk about that right now. You might say, well, when might be a good time, a better time perhaps for us to talk about it? Or they may say, well, gee whiz, I don't even want to talk about this at all. You say, well, I appreciate that. May I ask why it is that you might not want to talk about this? What is it that is challenging for you to have this conversation? So that puts you in a position where you actually are able to hear from them what it is that's most important to them, what their resistance might be, what their concerns might be, and gives you an opportunity, again, still to have the conversation, but it may not be the conversation that you had prepared for, but it's the conversation that is a step that you need to take with this person that you want to communicate with, a loved one as an example, so that you can ease into other conversations. Remember, this is a process. This is not one and done conversation. This may take several conversations, many conversations. And once you've had the majority of the major conversation and express what your wishes are, you may be, it's important that actually you're prepared to have multiple conversations after that, to revisit it, to be able to talk about it from different points of view so that your loved ones can start becoming comfortable with what it is your wishes are, and themselves may even consider doing their own advance directives. In addition to being patient, it's important that you're not steering the conversation. You're letting them speak, letting them guide you as to what they're willing to talk about, what they're maybe uncomfortable talking about. It's absolutely important because this is not just one conversation, it's multiple conversations, but it's most important not to judge, because if you start judging, then the conversation will maybe come to a quick close versus it being open-ended and allow you to meet their needs where they are in this conversation. Keep in mind that one conversation doesn't mean that everything's set in stone and that's that, because we know full well, even with your advanced directives, you can verbally change them, you can verbally revoke them, you can modify them verbally, and they only come into play when in fact you're in a position where you can't speak for yourself. And keep in mind that every conversation you're having with your loved ones is absolutely valuable. It begins to expand as each conversation takes place. You may be able to go a little bit deeper. But this first conversation, it's important to be patient and not judge where they might be. Just meet them where they are. And know that this is going to be the first of many conversations to come. Come back to page 8 in this document, and you'll see that there's some icebreakers, some excellent ones. For someone who likes to help, this first one is quite good. It says, I need help with something. Or I was thinking about what happened to Aunt Mabel, and it made me realize that I don't want that happening to me. It just seemed that, nobody knew what it is that she wanted. Everybody seemed to be in distress about making these decisions, and I don't want to burden you with that. I want to make sure that you know what my wishes are, and that you're able to be with me, not worrying about making these decisions, but being with me as I make my transition. I think I need to think about the future. Will you help me? Another opportunity for someone who likes to help. You might use that as an icebreaker. Or even though I'm okay right now, I'm worried that someday, based upon my family history, that I might be in a position where I might not be able to speak for myself, but I want to be prepared. And so I've created my advanced directives, and that's what I'd like to share with you today. And when it's all said and done, I think this video clip you'll kind of help put in perspective that it's okay. This is a letter to loved ones making difficult choices.
My letter's called Don't Panic, It's Okay, a letter to my family. If you are faced with a decision that you're not ready for, it's okay. I'll try to let you know what I would want for various circumstances, but if you come to something we haven't anticipated, it's okay. And if you come to a decision point and what you decide results in my death, it's okay. You don't need to worry that you've caused my death. You haven't. I will die because of my illness or my body failing or whatever. You don't need to feel responsible. Forgiveness is not required. But if you feel bad, responsible, guilty, first of all, don't. And second of all, you are loved and forgiven. If you're faced with a snap decision, don't panic. Choose comfort. Choose home. Choose less intervention. Choose to be together at my side, holding my hand, singing, laughing, loving, celebrating, and carrying on. I will keep loving you and watching you and being proud of you.
Okay, now that we've kind of reviewed how we might want to approach our loved ones, let's talk a little bit about how to talk to your doctor. We know that 80% of us want to talk with our doctor about end-of-life wishes, but only 18% of us have actually had that conversation. And so this is going to be a conversation we're going to have now about how to talk with your doctor. Your objectives in doing so is that we're going to assume now you've got your advanced directives completed, you've got the documents properly executed, and you now have copies of those documents. You've spoken with your loved ones, you've chosen your medical power of attorney, so you have kind of your house in order, your paperwork in order, and now it's time to talk with your doctor. And this doctor would be your primary care physician, and it would be every other specialist that you are working with based upon your health condition. So it's not just limited to your primary care physician, it also includes anyone else, anyone who's a specialist on your medical team that you want to inform as to what your advanced care plan. You may have a cardiologist, you may have a urologist. And it's important that you involve them in this conversation as well. So we're going to assume now that you have your paperwork in order, your medical power of attorney as well, assigned and agreed to. and you've spoken with your loved ones about your end-of-life wishes. So when you're ready to make the appointment, you want to let them know that you'd like to speak with your doctor about end-of-life care. So you want to make sure and give them a heads up. I'm calling today, and I'd like to make an appointment with Dr. Smith, and I would like to talk about my end-of-life care plan. So bring to the appointment 3 complete sets of your advanced care directives. The first set is for the front desk, and when you check in, give them a set of your advanced directives, which would include at least your living will and your medical power of attorney, and say that to them that you'd like these documents to be entered into your medical record. Now you leave them at the front desk. When you go into the appointment, the doctor comes in the room, you have a second set for the doctor to review with you during the appointment, and the third set, of course, is your set to be able to go over when you are talking to the doctor. So again, 3 complete sets of your advanced directives. 1 for the front desk, ask that your medical record be entered into your medical record. Second is for your doctor, and the third is for you to review with the doctor during the appointment. During the appointment, it's important for you to ask your care team to explain where things stand with your health today and what the future may hold. Keeping in mind that you are always the expert on what matters most to you. And be sure to let your healthcare team know your end-of-life goals and preferences. And then, like I said earlier, is make sure that you have that those 2 documents, at least the living will, medical power of attorney, a copy of them to be reviewed by the doctor as you review your own copy. As you see here, there's another document that's come up, making sure that you have a chance to download this from the conversationproject.org in the starters kits section. This is how to talk to your doctor discussing end-of-life care with your doctor, nurse, or other healthcare provider. And this is where this information is pulled from. So you're welcome, if you haven't downloaded this already, then go ahead and download this and follow through with completing this workbook as well. You also want to be talking to the doctor about hospice care, what, when, who, would they be comfortable recommending you be turned over to hospice when it's appropriate, when the right time is. Also understand that when you're eligible for hospice care. Also understand the difference between palliative care and hospice care. Again, when would the consult for palliative care be appropriate? Keeping in mind that when you're on hospice, you are receiving palliative care. However, before you are eligible for hospice, and eligibility is typically the doctor determines that you probably have 6 months or less to live, that you can receive palliative care before hospice as well. And that requires a palliative care consult. And these are doctors who have been specially trained in comfort care, including very deep knowledge about pain management. Talk with your doctor also about shared decision-making, what that looks like for the doctor, particularly your specialist, particularly your oncologist, because you want to be engaged. You're making it known that you want to be engaged in decision-making if you haven't already been, but certainly as you approach the end of your life, you may want to become more involved. As an example, with my late wife, she was involved in every decision right from the very beginning because that's the way she wanted to manage her care. And then, of course, make sure that with the doctor you're reviewing your advanced directives in detail and making sure the doctor understands why you have chosen the path you've chosen, or for you to also to be receptive to listen to the doctor and maybe hear it from a different perspective. You may have chosen one course of action and the doctor may recommend something different, but listen to the doctor and listen to what it is that they're saying and how that might even be more in alignment with what it is that you want to do than what you had already decided. So keep an open mind. Ask the doctor to explain what intubation and mechanical ventilation is. Ask the doctor to explain what nutrition is and hydration, when is it appropriate, when it might be recommended. Certainly understand in intimate detail cardiopulmonary resuscitation or CPR, because depending upon your health condition, you may or may not want to go through the challenges that represents, both physically and afterwards with regards to recovery. So do a little research on CPR and as CPR relates to your healthcare condition. As an example, if you were an 80-year-old and you were frail and you had osteoporosis, you may decide that you don't want cardiopulmonary resuscitation or CPR because you'll wind up with cracked ribs and you'll wind up in a situation where you may not be able to come back to the level that you were before CPR was administered. So that's an important conversation to have with your doctor. Also talk to them about what comfort care looks like. And of course, time-limited trial of aggressive care. This is basically where they may try something in a very aggressive manner for a specific period of time to see if they can, affect an outcome of better health or of getting you more time. But you need to be able to understand what those time limits are, what the treatment is, what the side effects might be for something like that. So make sure that you take into account that these are all decisions that you need to make because these are your decisions to make. They have to do with you, your body, your care, your comfort, and making sure that when you understand them, how they align what you want to do, and because that needs to align, of course, with what it is that you value most. So if you have questions, please take the time to get in touch with us. Give me a call, send me an email, a text, give me a call. In the meantime, be sure to check out our webinar schedule. We have a series of free webinars that we're offering throughout each month, and they're more of a deep dive into each one of the 3 Ds of advanced care planning. So please feel free to check that out. Plus, there's many, many more resources on this website under the resource tab that might be helpful to you as you make your way through this process of completing your advanced directives. Thank you so much for watching this video.